Briefing for this Wednesday. We're going to get started with our agenda. We've got a lot of items to cover today, and we're going to get started with some COVID-19 information. There is a community outreach program that is being launched by the health department and the CAO's office to reach out into communities with health information. And joining us is Krista Honey and Rosemary Soto, who are going to tell us about this program and what the goal is. Good afternoon, ladies.
Hi, I'm not sure Rosemary's on the call yet. Is she on the call?
Well, I see her.
Hi, good afternoon.
Good, great. Okay, great, Rosemary.
Well,
Sorry.
I see her screen, but yet she is invisible. So
Okay,
hopefully
great.
she'll show up.
She's here. Go ahead, Rosemary.
Hi, good afternoon. Thank you for this opportunity to share. We are excited to begin to roll out this pilot that we're still currently developing. And it is a strategy that is modeled after our experience with the 2020 census efforts to reach the communities that are the hardest to reach, that have most of that are experiencing the greatest impact of coronavirus. And we want to make sure that we are doing so. We're using approaches that are culturally relevant and responsive, and that will also include community in the development process of this work. So we're excited to begin this process with our community partners. Krista will share some more details on how the boots on the ground work will be laid out and our goals for the next several months.
Thanks, Rosemary. So public health uses community health workers, and many of our partners use community health workers to do education and outreach. And that really is a peer-to-peer model. It's proven very effective in public health for messaging, for education and behavior change. So we recognize that many of our partners, our trusted service providers and community partners in the community, have already been doing some of this work. We'd like to help expand on that effort, look at how we can support with potentially a couple community health workers in the health department staff, and to just expand the outreach that is happening and look at how we can do that strategically using some of that census outreach work that has already gone on and saw some really great increases in our census response rates in various census tracts in the county compared to the 2010 census response rates in those same census tracts. So as I mentioned, we think we'll probably have a couple community health workers working with the health department, supporting several organizations with some of their community outreach efforts and their community health worker work that's already happening, expanding that. We'll have training materials and curriculum. We are reaching out to several other counties that have also instituted the same approach. They're just a little bit ahead of the curve on us with some of those curriculum materials, and probably be very similar to what we would be having to develop. So that might allow us to get those boots on the ground even faster using already developed materials. So Fresno County, for example, is who we're reaching out to. And at the same time, we're wanting to continue and support some of the work to collect that feedback from the community on where their needs are, where any potential gaps in services, and to help refine our strategies that we have that have already been quite effective at reaching people when they are positive and their contacts, but really helping to improve on that and to also expedite the process for reaching people. So I think that's it in short. I think what's also important is when we get that information back, it'll be used to also inform the action plan for the district impact report and health equity investment plan that we do have to do for the state.
All right, thank you both very much. And if you could both stay on the line, we've got some questions that are already starting to come in, and as soon as everyone else is done, we'll start working on those questions. Now we're joined by John Ramirez with the Environmental Health Bureau of the Health Department. He's going to give us an update on the inspections that his office has been doing and where they are at with not only restaurants, but other businesses. Good afternoon, John.
Good afternoon, Maya. Good afternoon to everybody else. As you recall, last month I provided an update of where we were as far as our outreach and education to businesses in the unincorporated areas in response to the county's urgency ordinance to enforce the state guidance on wearing of face coverings. So as I explained at that time, the month of September would be our outreach and education month, and we would not begin issuing citations, hopefully until October. So I'll recap what's been happening through September and give you an update where we are right now. So right now we've completed outreach and education during the month of September. During that time, we found 1,416 sites that were compliant on our very first visit. In addition to that, 195 sites required 2 visits before we had compliance with face coverings. In addition to those numbers, we had 209 sites that required up to 3 more visits to attain compliance. Above that, we had 18 sites that required 4 visits to gain compliance, and 39 required 5 sites to get compliance. So a total of 1,877 sites were visited by Monterey County Environmental Health staff and our enforcement team. And we found it took a while, but some of them came into compliance. So that whole month of September was to make sure that all the sites in the unincorporated area that we had permitted under the health department and those not permitted that were being visited as often as possible were in compliance with the ordinance for wearing the face coverings. Of these sites, we found there were about 23 that we putting on what we calling a watch list, where it was difficult or we found resistance, where we know we have to go back more often to kind of check to make sure they are still wearing face coverings and enforcing that with their patrons at the site. Beginning in October, last week we began outreach and education efforts at our employee housing facilities. That includes all employee housing, including the H2A housing, to spread the word about the enforcement, the urgency ordinance and the requirements of wearing masks. And again, I want to point out that we not only give information out there, anybody we find not wearing a mask, we provide up to 3 to 4 masks at no cost to them. And then we also provide them face shields if for some reason they say they can't wear face coverings. Beginning in October, our team began issuing citations when efforts for compliance were not successful or those facilities that we found were problematic continued not to comply. As of yesterday, we have issued 11 citations. 5 of these were at food facilities, 2 sites with 2 citations on different days. And one of these sites, both owners on separate days were issued a citation. One site was a produce cashier and that person was not wearing a mask and they were cited. 2 other non-food citations were issued, one at a barbershop and one at a gym. One at a gym received 3 citations on 3 separate occasions. Just want to remind everyone that the first citation is $100. Second citation is $200 and the third citation is $500. So anybody being issued 3 citations faces $800 in citation fines. I'm going to touch a little more on the citation penalties and what we're doing a little bit later. But I know some of you will ask, so what I'm going to do is share my screen so you can see the facilities, which hopefully you can see the screen there.
Sure can.
Okay, so you can see the citations that we issued. Plaza Linda Restaurant received 2 citations. Both of the owners were cited there. The bakery, Panaderia y Paleteria, Michoacan was issued a citation. The Bagel Bakery, they were issued 2 citations on 2 different days. Head Honchos is a barbershop. They were issued 1 citation. Farm Fresh Produce, the clerk there was not wearing a mask, so they were issued a citation, as was the manager, or he was the one at the cashier. I'm not sure about which he was there. Aloha Cafe was issued a citation on the 26th, and the gym, I'm not sure where that was located at, but they received 3 citations for failing to wear face coverings. So I have that information there. To allow you to see that information, and I could send it to Maya if any of you want to get that later on. But I also want to inform you about is what our next steps in issuing those citations. So any food facility that was issued a citation is going to be mailed a notice of violation. That notice violation under the California Food Code and the Monterey County Code requires anybody who has a health permit to follow all local laws and state and federal regulations. So the guidance document and the code urgency ordinance is a local law that they must comply with. So the notice of violation is going to require that they have immediate compliance or they face suspension of their food permit, where they will not be allowed to sell for non-compliance. The notice of violation is going to be mailed this week. And what it's going to entail, it's going to provide them information outlining the days and times they were issued a citation. It's going to notice that they have a right to request a hearing if they fail to comply with that notice of violation. So let me step back. They'll get a notice of violation. That notice of violation will say you need to comply immediately. And if you don't comply immediately, you face suspension. So it's not an immediate suspension. It's giving the last and final warning. If you don't comply, you're facing suspension of your permit. And then the letter goes on to say that if we do find out that you continue to not comply with the ordinance, that you have the following options, that you have the right to request a hearing before an administrative law judge within 15 days. So you have 15 days to request that hearing. During that hearing process, if the administrative law judge finds that they're subject to the fines and penalties, including all of the costs that we've incurred on those multiple inspections, will be applied or potentially be applied to the person at the hearing. The administrative law judge's final determination can still be appealed in front of the Board of Supervisors. So the person will then go to the Board of Supervisors, appealing the decision of the administrative law judge and indicating to them why they should not be penalized or assess the fines under this process. So that's what's going to happen at the food facilities. At the non-food facilities, like the barbershop or the gym or any other place, because we're verifying with our county council, but what we have planned is that since it's an urgency ordinance under the Board of Supervisors, it's part of the Monterey County Code, so we can then employ the Monterey County Code section 1.22, which is the code enforcement ordinance. And under that, they also can still operate, but they'll be facing a hearing in front of an administrative law judge. We'll send them a notification saying you've been issued 3 citations. You're now being issued a citation, enforcement citation, and you're subject now either pay all the penalties and fines and comply, or you'll have a hearing in front of an administrative law judge to determine any fines and penalties. So that's what we have in process for them. So one, food facilities has a different set of regulations and enforcement, but it's on the same path as if the non-food operations are non-compliant. They'll still have an administrative law judge to hear their case, and then the findings and penalties would be subject under there. Under the Monterey County Code, if they don't agree with that decision, then they have a right to appeal in front of a court. So that's what the difference is in those 2 options. I just want to point out that although we've issued 11 citations, and it may not seem like a lot of enforcement with citations, but I want to point out we've been successful in enforcement by assuring that 1,850 business operations in Monterey County are compliant, which is what we're striving for. And the low number of citations is a measure of our success. It's not a sign of success about issuing it. It's the fact that we're issuing a small number. And over this month, we still may be issuing a few here and there. But as soon as I believe that the word gets out that there's penalties and consequences for not complying, that we're going to get the compliance. I also want to note that issuing a notice of violation is that says that your permit may be suspended is not intended for us to close that operation, but it's to make sure that they understand the consequences of continued non-compliance, and that they must comply with the requirements of the face coverings of the ordinance, just like everybody else. These non-food facilities who continue non-comply may also be referred to the district attorney's office, and they may enforce for unfair business practices, which they would use as part of their enforcement. So that is an update on what I have for you, and I'll turn it back to Maya, and if there's any questions, I can address those also.
Thank you very much, John, for that very thorough look at what has been going on. We'll take questions for John after all the other presenters. I do want to note that Dr. Moreno is on the line, but he is not going to make a presentation, but he will be available for questions that come in to us. Now we're going to turn from COVID to fires. The phase 2 debris removal is getting ready to begin in our fire areas, and that brings a lot of information for residents out there, that things that they need to know. So joining us is Kelsey Scanlon from Office of Emergency Services, and I think Rick Encarnacion from Environmental Health to talk about this debris removal phase 2. Hi, Kelsey and Rick.
Hi, Maya. Thanks so much for having us. I have a brief presentation here. Rick, feel free to hop in if I miss anything, or if you want to take over, that's cool with me too.
Okay.
Wanted to give a brief update. Yesterday, the Board of Supervisors approved an urgency ordinance regarding debris removal of hazardous waste and debris as a result of the 2020 wildfires, both for the Carmel River and Dolan fires. We also have Kendra Boyer from Cal OES on the phone to answer any specific questions regarding debris removal. But essentially what was presented in the urgency ordinance is that the removal of household hazardous waste is mandatory, and that's conducted by the US EPA. They are almost done. They have finished up the Carmel and River fires, and they're working through the Dolan fire area. Any properties that they weren't able to access, they'll be able to come back and do during phase 2 of debris removal, which is the removal of remaining debris that is not considered household hazardous waste. And that is done by 2 methods. Either property owners can opt into the government-sponsored debris removal program, or they can choose to hire a private contractor to do it on their own. It should be noted that property owners who elect not to participate in the government program are still required to remediate the property and remove all burn debris at their own expense and comply with requirements established by the Environmental Health Bureau. And they must do so in a timely manner. To give a brief overview of the differences, I first wanted to start with saying that the government program is anticipated to start on December 1st. Property owners must submit a right of entry permit to the Resource Management Agency by December 15th. They can do so as of yesterday, and I'll show you where you can download those forms. If property owners are choosing not to participate in the government debris removal program and choose to remove the debris on their own with a private contractor, they will also have to submit their opt-out waiver by December 15th as well. And they can submit them as of yesterday to RMA as well. The application or the opt-out waiver does not mean you can start removing debris. But you do have to submit an application and work plan. And if you have questions about the debris removal requirements, you can download the requirements guide that Environmental Health put together, or you can contact them directly. The government-sponsored program is completed by Cal Recycle under the direction of Cal OES and FEMA. This is at no cost to the property owner. However, if they receive any insurance proceeds, those will have to be given to the county. And that is after they have had all debris removed. So if there's something that's still on the property after Cal Recycle has come through, that insurance money can be spent to remove whatever's remaining. So for instance, a pool perhaps. Which isn't covered by the government removal program. So there's going to be an FAQ and press release specifically about insurance proceeds and how it'll go to the county. That'll come later on. But we've already received questions about that. So I'll just leave it at that for now. The government-sponsored debris removal program includes the removal of ash and debris cleanup, so they'll scrape the lot clean, which includes the foundation, the removal of cars, dangerous trees that are dead or dying and pose a threat to crews or the roadway, chimneys. It does not include pools, and Cal Recycle will also include erosion control measures once the lot has been cleared, at which point they will issue the county a cleanup certificate. The private contractor program, if homeowners opt out of the government-sponsored program and choose to do it on their own, as I had mentioned, they need to submit the opt-out waiver, the property owner application, and work plan. Just the submission of any of those documents does not mean that property owners can begin debris removal. All of those documents have to be reviewed and approved by environmental health, at which point they will issue a letter authorizing permission to begin debris removal. So I really want to stress this point that if you are a property owner choosing to do this on your own, just submitting the opt-out waiver does not mean you can go and start removing debris. There's a whole process that has to be followed. We highly recommend that all property owners, before they submit that waiver or even the ROE, review all of their options, review all of their requirements if they're choosing to do it on their own, because it is quite extensive and can be costly. It includes ash sampling, air monitoring, where you're planning on sending your debris, and who's going to do it. So there's, I believe, a 10 to 15 page document that needs to be reviewed by the homeowner if they're choosing to do this on their own, and they should not go into that lightly. Property owners will not be allowed to rebuild on their property until the county has issued a certificate of completion of this alternative program. So you will not be issued building permits if we cannot see where your debris has gone. Submittal of the right of entry permit or the opt-out application / waiver can be sent to Frida Escobar or can be dropped off in person at the RMA Permit Center. So there's a new webpage that's linked to the recovery webpage. If you just select the hazmat / debris removal, there's now a whole phase 2 webpage where you can download all of the necessary documents and information on how to submit it and the deadlines. We will be hosting a debris removal webinar with more specific information about requirements for both the government program and the private program, as well as allowing people to ask questions about both of those programs to inform them on which they should go with. And that will be held tomorrow at 5:30 p.m. It is a webinar, and the link is on the recovery webpage at www.co.monterey.ca.us/recovery. Rick or Kendra, do you have anything else you'd like to include?
Thanks, Kelsey. Rick Encarnacion, Environmental Health. Good afternoon, everybody. I'd just like to reemphasize for the property owners that choose to do the alternative program to, like what Kelsey mentioned, review all the documents. If you plan to do it on your own, please review so that you can make the right decision for yourself. Because the Cal OES and Cal Recycle performing the cleanup is probably the better option because they have all the resources to do it rather than trying to do it on your own. Pay attention to the deadlines for both submittal, whether you're opting into the government program or trying to do your own private program. But we're here to help. Environmental Health has been in close coordination with the state, feds, with OES, and with our building officers, our building officials, and our resource management agency to help people get back in their homes. So with that, please review all the documents, review the ordinance. We have a ton of information on that webpage that's before you. And again, we're here to help.
Thank you very much, Rick and Kelsey. Kendra, we're pleased to have you on the call today. Is there anything you'd like to add, things that people should know from Cal OES and Cal Recycle?
Good afternoon, everyone. No, I think Kelsey did a really good job of providing a cohesive, comprehensive description of what the state's program is, and I'll stay here to help answer any questions that do come up. Thank you.
Terrific. Thank you very much. And then we have one last speaker on our call. We've got Kevin Wynn from the Small Business Administration, who's going to give us an update on assistance for fire survivors. Hi, Kevin.
Hi, Maya. Thanks for inviting me today. We really appreciate it. To date, SBA has approved 286 disaster loans in the area for $33.2 million. 92% of the loans have gone to homeowners and renters for $30.8 million. There's plenty more of applications in the pipeline, so keep on applying if you haven't done so already. Go to disasterassistance.gov to apply, or you can call FEMA at 800-621-3362. Deadlines, November 23rd, but the quicker you get your applications in, the quicker we can process them. And for the economic injury disaster deadline, May 21st, 2021, for small businesses who need economic assistance to get them through the disaster recovery period. I'll be on the line for questions as well, and thank you for the invite.
Thank you, Kevin. And just to verify, the 286 loans that you mentioned, that's Monterey County.
Yes.
Fantastic. And I know we've already had a question about, would you type in those numbers in chat? And
Sure.
That would be great if you had a moment to do so.
We'll do it now, Maya.
Thank you. And with that, we're going to go to chat and see what kind of questions we've got. And we'll go to our first question, which was for Krista and Rosemary. What is the budget for the new outreach program, and which cities or areas in Monterey County will the health workers be focusing their efforts?
Yeah, this is a draft. It's a pilot idea. Our estimate right now for that draft is $75,000 coming from the state and federal funding for COVID response. And the areas that we're going to reach out to are going to be areas where the Healthy Places Index has indicated that we have the lowest quartile for that index, areas that we have to try to increase testing. And so there's Salinas, South County, some of the South County census tracts, and over on the peninsula and some of the North County census tracts, but certainly working with the community organizations that already have good reach in those communities is our plan.
All right, thank you. The next question I had, which was for John, about which bagel bakery location. And John, I think you said you were going to update the spreadsheet and send that to me, and I can share. So,
Yes,
great. Our next question is for Dr. Moreno. If I think you're still on the call. Why is the California Department of Public Health's reported positivity rate for Monterey County different from the county's reported positivity rate? Is Monterey County receiving the results from all COVID-19 tests performed here, and are all the results from the tests received prior to the county publishing its daily COVID-19 tests and positive rates? That's kind of a long one. Let me know if you want me to reread it.
Yeah, well, actually, that's probably a question for that could be assigned to an epidemiologist. So maybe I could take that question and let our epidemiologist work on it and get back to the person who asked.
All right, thank you.
Mm-hmm.
Another question for you now that we've got you here. Have Monterey County officials considered asking state officials about the possibility of allowing the Monterey Peninsula and other areas in the county with much lower infection rates to move into less restrictive tiers before the case rates in Salinas and South County are under control?
Thank you, Maya. At this point, the county is not approaching the state to make that request. The county is still aligned with the state guidance, which provides a framework, tiered framework for assigning counties into tiers and and we've been assigned to tier 1, purple tier. And we, as a county, need to continue to work together to reduce transmission so we get our case rates down and our positivity rates down so we can move into tier 2.
This is Charles McKee. If I could add into what Dr. Moreno was saying,
Please do.
yeah, so I think the point there is making sure that we work together as a community to try and get the rates down and using all the best practices that have been articulated. We understand that the state is kind of in control as far as how the state is separated geographically for the tiers, and that might seem, excuse me, arbitrary in the way that it's addressed across the state. And what we're doing is we are working with different business and community groups to look at ways to communicate to the state the different needs that might be in Monterey County, but also how it might fit into the overall framework that the state is looking at across all the counties of the state, recognizing that although we think we're very unique here in Monterey County, the ability for the state to have comprehensive plans on how they address COVID across the state, we think is going to be the only way to have any modifications. And the focus on driving our rates down is the primary focus at this point, as Dr. Moreno said, so that we can move to the next tier. So that getting everybody's cooperation, kind of follow with John Ramirez and working with environmental health on the inspections, it's using those best practices so that we can drive the rates down across our county is the primary focus, but it doesn't mean that we're not looking at ways to see if there's some flexibility at the state level, also recognizing that it's something that's going to happen across the whole state.
Thank you for adding that in. And Dr. Moreno, I've got another question for you now that you're here and available. 2 questions actually from this questioner. What is your best estimate of when Monterey County would move into the red tier? Let's start with that one.
Hi, Mia. So again, thanks for the question. This is a pandemic. This is a situation where there's a lot of factors at play that in determining the extent to which this virus is transmitting through the community. And I can't estimate when this county will meet the state's criteria to move into tier 2, but I can say that our ability to move in tier 2 is really very much dependent upon people living in Monterey County, working in Monterey County, and visiting Monterey County, adhering to measures to reduce transmission. And the way the state is set up is if we can reduce transmission, our rates will go down and we can move into tier 2. So again, I can't estimate when that's going to happen, but I do know it's more likely to happen if we adhere to the infection prevention measures that we've been advocating for. Thanks.
I'm wondering if you just might want to add that we are moving in the right direction, though, and in your Board of Supervisors presentation yesterday, there were other metrics that showed we were moving with some of our numbers into other tiers.
We have, Maya, a couple of ways to, back to the trends. Yeah, so if we go back to the beginning of the state's reporting of our county metrics, specifically the positivity rates and the case rates. Since that was implemented, we have, I think, more or less 8 or 9 weeks of rates reported by the state, and the overall trend is a downward trend. Overall trend in our total cases has also been down, and so yeah, I think there is a trend downward. It's a slow trend, but there's 2 ways. I'll add that there's 2 ways for us to get into tier 2. One is for our case rate and our positivity rates to get into tier 2 for 2 consecutive weeks, and then we can move to tier 2. Or if our 2 positivity rates both fall into tier 3, the state would then consider us moving into tier 2. So regardless of which path we take, they're both dependent upon us as a community reducing transmission of the virus.
Thank you. And then here's the second question in this group. What are your feelings about the Monterey Aquarium? It's a big driver of the economy in the area, and other aquariums are open in Northern California, but it cannot open because the county is in the purple tier. And the main driver of those is agricultural workers in Monterey County. Do you think the state should amend rules to allow for it to be open, and referring to the aquarium?
So I see Charles is back on screen. Charles might have an initial response.
Yeah. What I would say is that, of course, we wanted to try and open up as many operations and businesses and entities as possible, recognizing they're all important. It's very important to our community to have the big drivers like the aquarium for our economy, as well as the mom and pop shops. They're all important, especially to the people who rely on those entities for their livelihood. And we also know that any closing of businesses has its own effect on the health and well-being of our community. Yes, we would love to say, let's open the aquarium because it's something here locally for us. And we think, even if we think that there's a way to do it safely, it's still going to be driven by how the state articulates the plans and the guidelines. And what we have seen is that the state has taken a measured approach in rolling out different pieces of guidelines for different industries based on the tier method. And they may do the same for different industries, even when you're in the purple tier, as you've seen the personal services, for example. What we're doing is working with some of those industries, and including the aquarium, and to look at ways that we can help drive down the overall numbers to the county, because we think that's going to be the best way of getting into the next tier and open things up, and doing so safely, but also looking to see if there are ways to communicate to the state that some businesses and some industries can be done safely.
Thank you for adding that. Dr. Moreno, another question for you. There was a death removed from the Monterey County total the other day. And and I'm just going to add to the question, there were 4 examples of why a death might be removed or the data would be updated. Was it an out-of-county death, or was it ruled not to be due to COVID-19?
So thanks, Mia. So this has happened before, and unfortunately, I didn't look that up prior to this conference call because it's generally a technical matter regarding data being reported to our epidemiologist. So Maya, you mentioned 4 reasons why it could happen. I don't know if you shared that with all of the reporters, but just to name a couple, it could be that someone did die, but we determined that it was initially reported here, but it's not a Monterey County resident, so that gets removed. Sometimes one of our staff accidentally clicks the wrong button, and it reports as a death, and the state calls us to check, and we check back, and we check with the individual, and they say, oh no, that's not a death, and so we remove that as well. So there's different reasons why we would remove a death, and there's just a couple. All
right, thank you. And moving on to our other questions, again for you, Dr. Moreno, does the California Department of does the CDPH all facilities letter offering guidance on long-term facilities visitation apply to Monterey County even before it gets out of the purple tier?
All right, Maya, let's see. So I think what the individual might be referring to is a recent all facilities letter. Those all facility letters come out from the state to licensed facilities that are licensed provide some type of care and here in California, specifically in Monterey County. And tiers 2, 3, and 4 counties. In those counties, the long-term care facilities can have 1 visitor per patient at a time. So maybe that's what they're referring to. If we're in tier 1, and so I am checking into this, but from what I can tell on the calls, the preliminary calls I've had in tier 1, there's still the restrictions still apply to Monterey County because we're in Tier 1. But I would add that that there was also a recent update from the state stating that regardless of county positivity rate, which I take that to mean whether you're Tier 1, 2, 3, or 4, doesn't matter, the following patients can have one visitor at a time, and that's pediatric patients, labor and delivery patients, patients in end of life, patients with physical, intellectual, and or developmental disabilities, and patients with cognitive impairments. And I did check with Natividad Medical Center, and they said that they are complying with this updated guidance. And in addition, this wasn't part of the question, but in addition, the state also made it clear that they do support those that are students in the health profession career paths to enter the facilities, and they can also be allowed in patient rooms so they can obtain the clinical experience that they need in order to graduate and be licensed to take jobs as healthcare professionals in Monterey County.
Thank you, Dr. Moreno. And then I have a question for you, Kelsey. I hope you're still on the line. Is there an estimate on how long phase 2 debris removal will take? And will the work have to be suspended if or when it rains?
I'm actually going to defer to Kendra Boyer at Cal OES to respond to those two questions.
Sure, thanks, Kelsey. So in regards to the first question about how long it will take, typically from the start of debris removal to receiving the clearance form is about 2 weeks. There are several different things that have to take place, such as potentially asbestos abatement, and then all the hazard debris removal, and then soil sampling. So on average, about 2 weeks from start to finish for debris removal. And there is a possibility that work could be suspended for isolated rain events, but we don't anticipate shutting the entire operation down for rain events.
Thank you very much, Kendra, for jumping in on that question. And then I've got a follow-up question on the question we had earlier about the Monterey Bay Aquarium. So this might be one for both Dr. Moreno or Charles, if he is still on the line. Do you think it is fair that the aquarium is required to remain closed, losing tens of millions of dollars and laying off staff, when many of the COVID cases are farm workers in the Salinas Valley, many miles away from Cannery Row? And this may touch on a lot of different subjects, from essential workers and essential businesses to the state looking at COVID as a whole countywide.
So whether it's fair or not is a difficult question for anyone to answer. Where should the line be drawn? And we understand that the state is trying to figure out the best places to draw lines as far as what is the best way to stop the transmission of COVID-19. And we certainly want to have all businesses open. I know that there have been different approaches across the state. Some jurisdictions have addressed things more stringently than the state. Some of the Bay Area counties, specifically San Francisco, for example, and they've been able to move more quickly through the tiers, whereas some of the other jurisdictions haven't done anything any more stringent than the state, and they've also moved more quickly through the tiers. So there's going to be some never-ending debate about what is the best approach, and not being not being the person who's trying to evaluate how to do this statewide. I can't say whether it's whether that's the right approach as a statewide measure. What I would say is that we're going to continue to work on every effort to open the businesses that we think can be opened here under the state guidelines, and working with all our business partners as well as our community groups to try and do it safely.
Right, thank you for that. And then Dr. Moreno, I have one last question that's come in. When will you know the decision about the expanded testing site proposals that you made to the state? And how important is it to have the traveling teams proposed to handle outbreaks or testing at schools doing in-person learning?
Okay, thank you, Matt. So I don't know when we'll have a decision made by the state. I do know that they wanted that application in last week, as a Thursday of last week, and that they are intend to contact us and to have, believe, further discussions on to further understand why we need these testing modalities and our justification, and how that will help Monterey County achieve its goal to reduce transmission and move into tier 2. But I hope very soon, and it will most likely, it will likely be aligned with the opening of the PerkinElmer laboratory down in Valencia. So if the PerkinElmer laboratory is on track to begin testing 40,000 tests on November 1, then we could see a quick push by the state to approve, hopefully, these testing modalities for Monterey County. As far as the importance of traveling teams, I think that the way the state described the traveling teams, I think at this point that's probably a really good option for us here in Monterey County. We have quite a few now. Well, we have several schools that have in-classroom instruction. We also have some school districts that have some cohorts of children back on campus, as I understand. And we also have skilled nursing facilities and assisted living facilities who are doing the best they can to meet the state's requirement for weekly screening of their employees. But it is still a challenge for them to meet that strict requirement. So the traveling teams, I think, are the most agile option that was presented to us. And so I think they are very important, but we'll hopefully have a better idea of when the state contacts us and we have discussions to make sure that their intent for use of those teams matches and is aligned with our needs here in Monterey County.
Thank you very much, Dr. Moreno. That's all the questions that I have that have come in through in chat. And I see John Ramirez has put in a lot of information from his list of citations. And we'll see if anyone needs additional information, I'll send out the sheet after the briefing is over. Are there any other questions for any of our presenters today? And just as I was speaking, Dr. Moreno, this one may be for you. Childcare facilities have been open for months. Have you seen any evidence of a coronavirus spread at these sites?
Yeah, thanks. Another good question. And I would probably, before I forget, suggest that people continue to go to our website to look at the demographics of COVID-19 among Monterey County residents. And there is a table, one of the tables that we have, I believe, provides a breakdown of COVID-19 confirmed cases by occupation. And we do have one for, I believe it's childcare. It may be childcare and education. And I think it's been anywhere from 8 to 9% of all of the cases where we know what the business sector was. So right there, yeah, we do have some evidence that there's spread transmission in that those types of settings. But yeah, they have been open for months, and even at in the early stages of the response to COVID-19, there was a recognition that essential workers need to have a place for their children to stay safely while they're working in law enforcement or healthcare, for example. So the healthcare people who work in childcare and daycare settings, those that stayed in it were potentially exposed and continue to be exposed. So we would expect to see their share of being represented among those that were confirmed positive. So it's really important that that those are still working in daycare settings and childcare settings really do need to follow the state guidance that's out there to try to minimize the risk of transmission and to keep small groups of children together, so that if one person does have COVID-19, we have a much smaller group of individuals that need to quarantine. So thanks for the question.
Thank you. And that was our last question, unless somebody's going to slide one in as I'm speaking. And I'm not seeing anything, so that will wrap up our briefing for today. Thanks very much for joining us, both our presenters and everyone on the line. Our next briefing will be next week, and we'll see you then.